Most men hear the letters PSA for the first time when a lab report shows a number they don't understand. And suddenly that small 3-letter test starts to feel much bigger than it actually is, because no one ever explains it calmly, clearly, or without fear. And that's exactly why today's conversation matters more than you think. Because PSA by itself is not a diagnosis, it is not a verdict, and it is absolutely not a reason to panic, even though it's often presented that way. PSA stands for prostate-specific antigen, and the key word there is not cancer, not danger, not disease, but specific, because PSA is a protein made by the prostate gland, and its main job in the body is actually quite boring, and normal, helping semen stay liquid so sperm can move properly, which means every man with a prostate produces PSA every single day, whether he's healthy or not. The problem starts when men are told, usually without context, that their PSA is high or borderline or rising, and their brain immediately jumps to the worst possible conclusion, because fear fills the gaps that education leaves behind. So let us slow this down and talk like a doctor who actually sits across from men every day and sees the anxiety in their faces, because PSA is a signal, not a sentence. And understanding that difference can change how you experience aging health and peace of mind. PSA lives in the prostate, but small amounts leak into the bloodstream, and that leakage increases whenever the prostate is irritated, inflamed, enlarged, stimulated, or simply getting older, which already tells you something important, because none of those things automatically mean cancer. In fact, the most common reason PSA rises is not cancer at all. It's benign prostatic hyperplasia, or BPH, which is just a medical way of saying the prostate grows with age like gray hair or wrinkles. And as the gland gets bigger, it produces more PSA and leaks more of it into the blood, even when there is no danger present. Another very common cause is prostatitis, which is inflammation of the prostate, sometimes from infection, sometimes from stress, sometimes from pelvic tension, sometimes without a clear reason at all. And prostatitis can spike PSA dramatically, temporarily, and then bring it back down once the inflammation settles. Even everyday activities can raise PSA for short periods, including ejaculation, long bike rides, intense exercise, digital rectal exams, urinary retention, dehydration, or recent illness, which is why a single PSA number, taken out of context, is one of the most misunderstood tests in men's health. Now let's talk about numbers, because this is where confusion really starts. Traditionally, many labs list a normal PSA as anything under 4.0 ng/ml, but that number is outdated, oversimplified, and frankly misleading when used alone, because PSA does not exist in a vacuum. A PSA of 3.8 in a 75-year-old man with a large prostate may be completely normal, while a PSA of 2.5 in a 45-year-old man that has doubled in 1 year may deserve closer attention, not panic, but attention. Age matters. Prostate size matters. Rate of change matters. Symptoms matter. Family history matters. And ignoring all of that in favor of one cutoff number is how men get scared unnecessarily, or, just as dangerous, falsely reassured. Many urologists today think in age-adjusted ranges, where PSA under 2.5 may be expected in younger men under 3.5 in middle age, and under 4.5 or even higher in older men, depending on prostate volume. And even those are guides, not rules. What matters far more than the absolute number is PSA velocity, how fast it's changing over time, because slow, gradual rises often reflect normal aging or benign growth, while rapid, unexplained jumps deserve a closer look. But even then, a closer look does not mean worst-case assumptions. It means asking better questions, repeating the test under controlled conditions, ruling out inflammation, and sometimes using more refined tools before anyone ever talks about biopsy. This is where modern prostate care has improved, even though many men don't hear about it. Today, doctors look at PSA density, which compares PSA level to prostate size, PSA doubling time, which tracks how quickly it increases, and PSA ratios like free versus total PSA, which can help distinguish benign causes from more concerning patterns. Imaging, especially prostate MRI, has transformed how we evaluate risk, allowing many men to avoid unnecessary biopsies altogether, and that's an important point. Because the goal of PSA testing is not to find cancer at all costs, but to identify clinically significant cancer that actually needs treatment, while avoiding overdiagnosis and overtreatment that can harm quality of life. Now let's talk honestly about the fear word cancer, because avoiding it doesn't help, but neither does exaggerating it. Yes, PSA can be elevated in prostate cancer, but most men with elevated PSA do not have aggressive cancer, and many prostate cancers grow so slowly that they will never cause symptoms or shorten lifespan, especially in older men. That is why modern urology has shifted away from knee-jerk treatment and toward active surveillance for many cases, meaning careful monitoring rather than immediate surgery or radiation, because preserving urinary, sexual, and emotional health matters just as much as treating disease. PSA is one piece of a much larger puzzle, and treating it like a standalone alarm does men a disservice. When should you actually worry about PSA then? Worry is probably the wrong word. Awareness is better. PSA deserves attention when it rises rapidly without explanation, when it continues to climb despite treating inflammation, when it's paired with abnormal exam findings, concerning MRI results, strong family history, or symptoms like unexplained bone pain or weight loss, which are rare and usually late signs. Even then, worry doesn't help. Action does. That action often starts with repeating the test after avoiding ejaculation and heavy exercise for 48 hours, staying well hydrated, and treating any urinary or prostate inflammation first, because many high PSAs normalize once those factors are addressed. This alone saves thousands of men from unnecessary fear every year. It's also important to talk about screening timing, because PSA is not a one-size-fits-all test. Men at average risk often begin discussions around age 50, while men with higher risk, including African ancestry or a strong family history, may start earlier, around 40 to 45. But screening is a conversation, not a command, and decisions should be individualized based on health status, life expectancy, and personal values. A healthy 70-year-old man may benefit more from continued monitoring than an unhealthy 55-year-old with multiple serious conditions, and PSA alone cannot make that decision. Lifestyle also plays a role in PSA and prostate health, though it's often overstated or oversimplified online. Diets high in processed foods, chronic inflammation, obesity, insulin resistance, poor sleep, and high stress can all influence prostate biology indirectly, while regular physical activity, balanced nutrition, healthy weight, and stress reduction support overall hormonal and inflammatory balance, which may stabilize PSA over time. None of these are magic fixes, but they matter, especially when combined. One of the most harmful myths around PSA is the idea that lower is always better, because extremely low PSA achieved through medications or supplements without medical indication can mask meaningful changes and create false reassurance. PSA is a tool, not an enemy, and suppressing it blindly is not health optimization. Another myth is that once PSA rises, the damage is done, which is simply not true. PSA fluctuates, sometimes dramatically, and many men watch it come down just as unexpectedly as it went up, especially once benign causes are identified and treated. That's why emotional reactions to a single lab value are understandable but unnecessary. Your body is not a static machine, and your prostate is not exempt from that reality. Let's also talk about the emotional side of PSA testing, because numbers hit men differently than symptoms do. Many men feel fine physically, but mentally spiral after seeing a lab report, losing sleep, imagining worst-case futures, withdrawing emotionally, or avoiding follow-up out of fear. This silent stress matters because chronic anxiety affects hormones, immune function, relationships, and quality of life, and ironically can worsen the very health markers men are worried about. A calm, informed approach protects not just the prostate, but the man attached to it. That's why I always remind patients that PSA testing is not about predicting death. It's about guiding decisions while you're alive, healthy, and in control. The best outcomes happen when men understand their numbers, track trends, communicate openly with their doctors, and refuse to let fear make decisions for them. Medicine works best as a partnership, not a dictatorship, and PSA is a conversation starter, not the final word. If there's one message I want you to carry with you after this, it's that your worth, vitality, masculinity, and future are not defined by a lab number. PSA does not measure your strength, your desirability, your longevity, or your value. It measures a protein made by a gland that changes with time, and understanding that simple truth can free you from unnecessary fear. Aging is not failure. Monitoring is not weakness. Asking questions is not denial. It is responsibility. And whether your PSA is low, high, rising, or fluctuating, you are not alone in this. You are not broken, and you are not out of time. Modern medicine has more tools, more nuance, and more respect for quality of life than ever before. But those tools only help when men stay informed, engaged, and emotionally grounded. So if you're watching this because you're worried, take a breath, because worry is not required here. Awareness is. Calm is. Action, when appropriate, is. Your prostate does not define your future, but how you respond to information does. And the most powerful thing you can do right now is replace fear with understanding. Because knowledge doesn't just protect your prostate, it protects your peace of mind. And that, in the long run, is just as important as any number on a lab report.